All right.
And Julie, I'm going to take some notes today while you all are talking. I will just quickly, I wanted to show a couple of resources really quick before we just get rolling into the conversation. So I just wanted to show a couple of things today. There were a couple of resources that were emailed out. Hopefully everyone got that last night, and last Friday I think it was also emailed out. But the first was a practice guideline from NASW on reopening practice. Assuming we'll probably use some of this as a template to talk about today, as well as what you all are doing specifically in your organizations and what you're thinking about doing in your organizations. The CDC also had put out some guidelines. I think really for this, where I see most people maybe using some of the flyers, maybe having them in your office if you have an office space that makes sense to do some of that. And then I wanted to just quickly mention, if you didn't see NASW's email that came out yesterday, the member link, make sure to check that. There's some good resources around kind of the racial profiling stuff and race-based violence. We are hosting a conversation on Monday. It's a community forum. Let me see, let me just pull it up really quick. So it's, my computer's being a little slow, but it's Monday at 5:30. It's going to be just a social work conversation around racial justice. We wanted to also make sure, just like this conversation is timely, that we are responding to our members and your needs around all of the police brutality, the protesting, and also to kind of help assess where the field is in a lot of these issues. NASW-MI put out a statement yesterday that they're going to be relooking at social work curriculum across the United States and how they address cultural humility, social action, and more focus on macro social work, which I think is really wonderful. But we want to make sure that we have our own conversation here in Michigan. So if you haven't signed up on Monday, it's 5:30. We originally had a cap of 100 people, but after 20 minutes of having registration open, we filled that up. So we were able to extend our Zoom account, and we're end up likely going to have about 1,000 social workers on that call. So wish me luck moderating that, but we know that there's a big need, and what we're also hoping to come out of that conversation is second resources. So we want to have regional discussions following this continually. We're also looking at developing either a task force or committee of social workers that are continually kind of work and provide guidance for us as an association on a lot of these topic areas, as well as look at some training opportunities. So that's on Monday. And then the last thing I wanted to just quickly make sure folks knew about is we are starting a self-care series next Wednesday. It's going to be every other Wednesday from 12 to 12:30, and it's just going to be something that anybody could do at home, at their office, likely going to be some body-mind practice. The first two are going to be some sort of chair yoga or mindfulness, and they don't cost anything. They're open for members and non-members. You can either join through Zoom or they'll be live on our Facebook page. You can sign up for those if you want to get that link on our website. We are also recruiting folks. If you're interested in facilitating one of those self-care, we're open to all sorts of topics as long as it doesn't really require that the social worker have any equipment and is basic enough that pretty much everybody could do it. So it could be art, could be somebody's going to be doing one in July around like family mementos and what that means as it relates to self-care. So we're hoping people will get creative. So if you're interested in that, please feel free to sign up for that. But those are my main announcements. So I will go ahead. I'm going to continue to let people in. All right. Let me just see. Is Ashley on yet?
I was going to ask you that.
I am here.
Ah, great.
Great. Hi, Ashley.
Hi there.
Hi. Okay. There we go. So for those of you who may not know, my name is Julie Weckel, and this is usually the time that the private practice group meets. We do that most months, most first Fridays of the month. But because of COVID and all of the adjustment everybody's making, and NASW is putting forth so many more resources and avenues for us to all get together, this just, our general meeting just kind of slides into some of the other meetings, self-care and the clinical group that NASW-Michigan is putting together for us. So generally we have an agenda for today which covers multiple topics. But again, because of COVID, we're trying to be fluid and really identify the issues that are of the most importance to people or timely for them. And so this month we decided we were going to talk about the reopening because we know that some people's offices have been shut down this entire time. Other people may have already started opening, or maybe you never closed. I have a private practice where I go to people's homes, so I don't have an actual physical office that people come to me. And I have continued to see people in their homes and have kind of tried to navigate the challenges that brings. But I think this is a very important meeting to have and topic to discuss because there's so many different avenues that private practitioners may have to face. I had a death in the family. My mother passed away beginning of May. And so I reached out to Ashley Carter Youngblood and asked if she would be willing to kind of lead on this topic, just because I've been obviously a little preoccupied and my focus has been elsewhere. So Ashley has been gathering information and she's going to kind of facilitate this part of the meeting. But we're still here, and as always, this is a meeting of collaboration. So please feel free to share your information and join in the discussion. So at this point, Ashley, I'm going to turn it over to you to start leading us on this talk. Thank you.
Julie, just quickly, will we have an opportunity to do the support of each other beyond opening offices, an opportunity to talk and share feelings?
Thank you, Max. Absolutely.
So maybe the second half of the meeting?
Yeah, absolutely. I mean, the meeting goes until 11:30. That's our general timeline. And if we're able to get through the topic of opening or reopening offices, definitely, I mean, we can do case studies, we can talk about self-care or any other issues that people may have that want to bring up. So Max, thank you for identifying that, because yes, this is still a meeting of multiple topics.
And a support group.
Yeah. Yeah. Okay. Ashley?
Sure, I can attempt to take it away. I probably won't do as good of a job as all of you do, but thanks for at least letting me, participate and kind of share my perspective. I'm always so impressed and encouraged by the support that both you and Dwayne and everyone else at NASW has. So it's nice to be able to reach out and actually have some dialogue about this. I originally reached out, I think, both to Dwayne and Julie because I was getting questions from clients about, hey, are you going to reopen? And there was this trend towards, especially in Michigan, we had, in my portion of Michigan, we hadn't seen nearly as many of the COVID numbers that we expected to see. So there was kind of murmuring of what would change on the executive order front. And so I was thinking a lot about what that would look like and when would I feel ready. Also from a professional liability standpoint, what would be the risks potentially that I would want to consider or frankly avoid altogether. I think a part of it for me was also the ethical component at the time when personal protection equipment was really, really sparse. If I'm going to open my doors, but I also have this requirement / recommendation to provide clients with personal protection equipment, do I ethically feel okay doing that? Because that means taking that essentially away from people who are on the front lines. So the more that I kind of thought about it and meditated on it, the more I realized that it was this multifaceted thing that I really wanted to consider in all ways, not only necessarily what made me comfortable with it, because I've been pretty even keeled through all this, just personally from a medical perspective. But I ended up, so I'd love to hear your feedbacks about that. I can share I sent a bullet pointed list of here are all the things that I'm kind of considering. And I actually ended up sending that same bullet pointed list in a client newsletter that I had to get feedback from clients. And I have made, per the executive order that was required by June 1st, I have officially made a COVID response plan. And I feel like I have a good foundation personally for my own practice, and I'm a sole practitioner, about how to proceed, and I've had good feedback from clients that's helped me make that decision. But I just wanted to kind of open up the floor to see what you all are considering when you're trying to make this decision, both from an ethical standpoint, liability standpoint, your own personal preference, because the NASW has also offered, and I know Dwayne shared that, like the private practice guidelines, and then we also have something from the CDC, but it's, it's kind of constantly shifting, so. I am not a host, but Angela, I see that your hand is up. I can't see everyone's video, so I think just speak up if you have a thought.
I mean,
Oh, are you there?
I decided to join. I'm Angela Baranski, and I'm from Psychiatric Associates in Lansing. And we decided, yeah, can you hear me?
You are very choppy.
Can you hear me okay?
No, I can't, at least. I don't know if it's only me.
I'm here. Okay. I'm Angela Baranski, and I'm from
Yeah, Angela, I can't hear you at all now.
And we decided to not close at all during. I'm sorry. Let me close windows. Let me see if I can close windows in the back. I have an old computer.
Angela, you may want to
Hang on a
consider
second.
writing something in the chat box
Okay.
as well, too. It looks like no one can hear you.
Hold on, mute. Can you hear me better now?
A little
Does
better.
that help?
Oh, no, now you're glitchy again. You probably just want to put it in the
Let me
chat.
try one more thing. Hang on.
Hey, Angela, I'm going to recommend you work on your end,
Okay.
and let's see if somebody else
Okay,
has.
you can't hear me now?
Okay, now that's better.
Is that better?
That's much better. Okay, Angela, did you want to try?
For some reason, I can't can you hear me now?
No.
No.
So how about, Angela, how about, like Julie said, you work on it on your end, and then we'll put you on pause, and you can put your comments in the
think
chat.
it's not that we can't hear, it's that your signal is really, really bad. Most of the time your picture is frozen, and it comes through with kind of a garble, and that's why we can't understand it. We can hear sounds, but I think you've got a really bad connection.
Okay, so I'm wondering, has anybody fully closed their office and you're about to reopen.
Okay, I'm back. Sorry.
Nope, Angela, that wasn't working, so I muted you. I think the best is probably going to be typing into the chat box, unfortunately.
Okay.
Thanks.
Okay.
Okay, sorry about that.
Okay, so let's just kind of keep moving then. Sorry, Angela, that it's not working right now for you. But let's look at
Okay.
people who have,
I changed my, I did change my internet on, can you hear me okay now?
No.
No, you'll have to use the chat box, Angela. It looks like your connection isn't strong, so we're gonna go back to Julie's question about someone else. You can just put it in the chat box. Sorry, it's not working.
okay, so for those of you who have completely shut down and you're about to open up, other than the resources that Dwayne sent out, has anybody been able to successfully put into place safety protocols that you can share with the team, with the group?
Hello, can you hear me?
Yeah.
Hi, I'm Nancy from Michigan, obviously. So we have 3 private practices. We're a group, Ann Arbor, Livonia, and Royal Oak, and I have 11 LMSWs to work with us. And we shut down. We're still going to do telehealth, but we are going to honor the CDC requirements. We have a laminated questionnaire for clients. When they come in, they'll be asked these questions when they make the appointment. And then again, when they come in, there's also a laminated questionnaire for each therapist to identify that they are symptom-free at the time of their shift. And I went over all this and I made them all document it and I put it in their personnel file as well. We also have masks available. We have sanitizer, we have wipes, and we have a thermometer in each of our offices, and clients are going to need to take their temperatures. We've also taken away most of our chairs. Nobody will be allowed to accompany anyone. It's basically like a doctor's office. You cannot accompany someone to the appointment and you have to stay in your car. We're physically locking all the doors, and we will allow you to come in. We will escort you in, do all this in the waiting room. And then if you pass, you can come into the treatment room. I took away all my coffee, everything. So it's treatment and you leave. That's the way we're going to do it for now.
Wow, that's really, that's quite extensive. I appreciate you sharing that. As far as, and maybe Ashley, you ran into this too, cleaning things down. So the laminated forms and people coming in and out, the masks or the shields, if people are wearing shields, what are people using to clean them? Do we have guidelines on that?
For us, the therapists are responsible, so they need to sanitize. So normally in our office, it's every hour on the hour, right? Now it's not that way. It's maybe a half hour in between clients. So, and then we're trying to make everything surface free. So all my offices are different depending on which office you come to. But in most of our offices, we're able to make everything touchless so that we're able to leave all the doors open because nobody else is there. I'm only allowing 1 therapist in the office per day. And so then that way we can minimize social distancing. And so when you're there, you're there. So in one of my offices, I have a beautiful waiting room with comfortable couches. I'm going to do my therapy in the waiting room. I'm not even going to allow them to come into the office. And then I have some spray down disinfectant that's 99.9% whatever. And I'll spray the couches and use the white. I stocked up when this was happening with thermometers, gloves, all of that stuff, so that we would be protected. And we're going to spray down the furniture in between clients.
Yeah, I think that's a good point, Nancy, which, you know, when I was exploring questions for myself in my practice, what to do related to Julie's question of, I think part of the challenge though is the effective or the, you know, officially approved cleaners, they may not be readily available to people. I mean, I don't know about you, but where we are, you know, I didn't stock up because I'm just one person, and I actually had other things going on in my life where it wasn't even available at that time. So I think part of the challenge is we literally may not, as practice owners, have the either personal protection equipment or the cleaning supplies to be able to do things the way they need to be done in order to be able to physically open. I don't know if anyone else has found that to be the case though. You know, I don't want to be able to open back up and then all of a sudden I run out of Lysol wipes and now I'm like, oh, well, I have to close again, you know?
Yeah, I find I have plenty of Lysol wipes and things like that. Well, I don't know if it's plenty, depending. But I'm curious, Nancy, all of my furniture, including in the waiting room, is upholstered, at least on the seats. And so the idea of wiping things down as you would with a hard surface, I can't do. You're saying you're using spray. I've looked online at places and all of the sprays are out of stock. And I don't even know what I can use that doesn't leave things sort of wet. And so I've been very curious as to what people are doing with that.
Well, in our waiting room, Sue, in a couple of our waiting rooms, we have leatherette. So leatherette is really clean. You know, you spray it down. And in a couple of my offices, we also have like leatherette club chairs. So I'm encouraging the clients to sit there. And then I will sit in, I've actually gone back, only one day, but I've gone back. And then I sit in my regular therapist chair, so I can wipe that down after, you know, everything. And then I can wipe down the leatherette. In terms of, we don't let them sit down. I mean, it is what it is. They cannot sit down and lawyer in our waiting room. They come in, they get their temperature, they do all that stuff, and then they're escorted right back. There's no reason to listen to the radio, grab a cup of coffee, go to the bathroom. They're here for therapy, and then they're escorted back out. And so I found this thing at Home Depot. It's called, because we had to clean our toys. We threw a lot of toys out because we see children. So I made the therapists who see children go through all that. We threw what we felt we needed to out, like coloring books, crayons, markers. And then what we felt we safely could disinfect or clean, we did all that before we reopened. And there's this stuff called Odo Ban. It's O-D-O, like odor, O-D-O, ban, B-A-N. And you can get a couple different versions. One is a neutralizer, which I got, and then one is a disinfectant. And as of 2 weeks ago, they had them at Home Depot. So, or you can order them online. I'm not ordering from Amazon for a couple of reasons. So I ordered like my gloves from a home health agency. I ordered my thermometers from Walmart. You know, like I didn't want to go and do a big like Amazon, because I was afraid I wouldn't be able to get my supplies. And that's what we're kind of doing with all of that stuff to kind of like minimize. And then I had all my offices professionally cleaned. All the upholstery, all the carpeting, everything was cleaned and sanitized these last 3 months before we opened, which quite frankly, it probably needed anyway. So, you know.
It looks like part of the challenge for people as I'm looking in the chat is, like Vanessa says, so what about no touch suggestions for restrooms? So, you know, do you leave restrooms accessible? But some other people saying that, you know, they may not necessarily even have the ability to have 6 foot distance in between chairs from a social distancing perspective. So, I mean, those things sound like there are certainly things to consider. I'd be curious to see how people are making those decisions. I guess in some ways, bringing up those things, I'd also be curious to hear if you're talking with your clients and if you're considering some of those barriers to being able to reopen your doors. Have you been talking with clients about if they're even interested in doing in person? I think what's been really shocking for me is that I haven't had any pushback at all about people being concerned about returning to in-person sessions. And so I don't know if that's unique to my office or not, but I'd love to hear what your experiences are.
For my practice, and again, I go to people's homes, I am still about 2/3 video or phone sessions, 1/3 visiting people in their homes. And the last 4 new referrals that I've received, people have all requested that it be telehealth in some version. So that, you know, so the people who knew me and are used to me coming out, you know, we went over the protocols for safety and the risk if I come in and I expose them to something just by the fact that I'm out and about. And the people who have a connection with me or are extremely isolated, because there are many of my older folks who literally went more than a month without seeing another person other than myself. That was a little bit more important to them. But for the most part, people are preferring the telehealth.
I've had several people ask if I had a couple this week who I just see like monthly and asking, so are we still doing telehealth, you know, at the June or beginning of July or whatever. And I said, at this point, I'm not sure because I haven't figured out exactly how I'm going to take care of the cleaning and stuff in the office. And, you know, they're fine with that. They seem to be. I have asked a couple, are you saying you would rather come in if I'm open? And again, they don't seem to care. They say this is okay. I have several who are very high risk who certainly want to continue telehealth for some time, regardless.
You know, Margot was talking about play therapy too. That's another thing for people who work with kids that I've heard has been a major challenge, just to be able to do that with telehealth. So, I mean, from a business perspective, some people may feel like they have to return to in-person sessions.
It's interesting. My experience with my private clients is that they want to come back. I see people out of my home and they want to come back. Most of them want to come back for a couple of reasons. One is that they don't feel they have privacy in their own homes to do telehealth. And I have one client who talks to me every week from his car. I have another client who takes his cell phone to the airport and sits outside and talks to me. I have one client who has to move back and forth from room to room because the kids follow her around. And I have my trans clients feel sometimes that this is the only place, my home is where they can be totally themselves as they're working through transition. So it's a safe place for them. And then some of my teenagers, I have dogs and cats that do therapy with me. And people miss the contact with the dogs and with the cats, I think more than they miss me. So those are the things that I think are moving people back into wanting to be seen at my home. And it's a more personable place. So I have 2 clients that I see now non-virtually. And one is a teenager who never leaves her parents' home, even when there isn't COVID. So he comes in and washes their hands, uses antiseptic, and wears a mask. And is struggling with putting on a mask because it's so isolating to them. So my next phase is going to be with the two people that I see, is trying to find a way to have them be able to come in without having to wear a mask. I mean, the masks are really, they change the impact of therapy. And I'd be interested in how people who are seeing clients are handling the mask issue.
Yeah, nonverbals is what some of the people are talking about on chat, which I think is a great point, that what's better, being able to like see someone in telehealth or having that huge portion of nonverbals be eliminated in context of the therapeutic relationship. Yeah, even if the CDC recommends it still, I mean, is it in the best interest? Or is telehealth easier?
I know that for what I'm doing, and again, I'm working primarily with the elderly, so there's oftentimes hearing difficulty. And many of my clients they don't read lips, but they watch lips to help them understand what's being said in the general context. So the mask really did become quite a barrier to our communication. And so I purchased a shield, just a plastic shield. And as I'm going out this week, I'm giving the choice to my clients which one they prefer for me to use. And they're mostly leaning towards the shield. So I find it's kind of, there's a little bit of a tunneling effect, because, you know, it comes around to about here, and I think I get a little bit of a muffle to my own ears. But the clients say hearing wise, it's a little bit better than the mask. I find it a little bit more comfortable because I'm not breathing in the material. You know, I find I was coughing more because I had fabric in front of my mouth, which is a little counterindicative with COVID. You don't want to be coughing. And I just felt that barrier had been lifted. So I'm kind of liking the shield, and I just got it. I did order it on Amazon, and it came within 3 days, I think. My question though is, how do I clean it effectively? So I just got a package of 10 of them. So I'm kind of like pulling them out in between clients as I drive. But I'm really concerned about how I'm going to clean this thing, because any cleaner could smudge it, and it's not like glass, it's plastic, so it's a little distorted visually also. But I want to make sure that any disinfectant I use is effective without smudging. So I haven't quite figured that out, but I'm working on it.
I noticed June Moskowitz is on the phone at least. June, can you talk a little bit about working with the deaf and hard of hearing under this situation? You're on mute. Oh, well, I tried. June is someone who does a lot of work with deaf, hard of hearing, and deaf blind clients. And I was hoping we could get her perspective on working with that community, but I tried.
In response to you, Julie, with the shield, I saw the shields on display at Staples this past weekend. So I know they have them also. I wasn't sure why people would use them in an office like that if they're wearing masks, but that's an excellent kind of point that you make. I would think that you could just use the regular Clorox or Lysol wipes, but you know, like they say with other things, to just do a spot to see if it makes a difference, because you certainly don't want them clouding up or something like that. But I don't know if you can just test spots that would be out of the way somewhere that might work.
Yeah, that's what I'm going to have to do.
I'm happy to share. So I work, I feel very fortunate. I work in a hospital. And even though my primary work is doing individual counseling in our mental health clinic, a lot of the staff have been tasked to work the COVID screening tables for patients, visitors, and staff who enter the medical center. And so we do have to wear a mask and a shield for that work. And I'm happy to share kind of our directions for the face shield washing process for how we sanitize them and how you store them. Mostly being mindful that when you're sanitizing them, that you are doing proper hand hygiene, you know, before and after, wearing gloves. So it's more than just cleaning the shield, but it's also how you're doing it to make sure that you're not accidentally, you know, putting additional, you know, germs on the face shield, and then how to store it properly. So I'm happy to share that. It doesn't have anything that, as far as being specific to a hospital, the resources would be available across the board, but the process may be helpful.
Yeah, go for it, sir, if you want to share.
Sure, I'll send it to Dwayne.
Okay. The other thing too that, you know, looking at the practice guidelines put out by the NASW about reopening, there were a couple of things reading through that, and someone just shared a link on the chat that I think are maybe part of our struggle too as private practice clinician is, you know, in certain parts it talks about develop guidelines determining when and how long those who've interacted with a diagnosed patient would be out of the office. I think part of my difficulty is like, well, what are these guidelines? Are we just kind of making these up as we go? Or, you know, how do we even know what's best practice? Because the CDC isn't even always consistent in what they're recommending us to do. As well as the reporting component, you know, I understand it may be mandated but from a privacy standpoint, if I have a client test positive and I have to tell other people that I've had a client that tests positive, and that just feels like something that's will be really, really difficult to do, even if they understand that that's a requirement. And the other component about doesn't necessarily mean that you have to reopen your office to all clients. There's a part of me that just kind of feels uncomfortable with the idea of almost like discriminating from like the essential workers. Like why would I not want to see a nurse in person when I would see someone else in person? And I don't know what some of those other sticking points are that you all are struggling with considering reopening.
Can I have something to share. So I suffered a stroke in December, and it took me a while to like try to get back into seeing some clients that I was seeing. But then all this, you know, the pandemic came out and all, and I struggle anyways with trying to write. And so it makes it very difficult for me to even do that. I'm so glad that this is being offered, because it's given me a lot to think about whether or not I really can continue for right now. So so I just I only have one person that I'm seeing telehealth, but she pays cash. And I have one other one who I've been seeing for many years, who will not wear a mask, who wants to see me, and I haven't been able to take her on. I just recently took my Psychology Today thing offline because I'm really not getting clients, and I had to like stop with my billing company. They kind of just have me temporarily on hold until I can get things together. I do work out of my home. So I really can't be bringing people in, also because of the fact I have a family member who also works from home, and she's very highly compromised. So my thing is, with the ones that I am seeing, I do have a very nice gazebo in my backyard. It's very private. I have lots of trees, and it's very secluded and private. And they have suggested to me that they would see me there. They are okay with that. So I'm still a little leery. My thing, other than that, is the fact that for my billing purposes, I have to have at least 4 people to make it feasible to even use a billing company, and because I get charged so much a month anyways. I don't know if this is the place to put it out there, but I was wondering if if anybody has cash payers, and how that works. Can you do therapy without going through insurance? Just putting it out there. Thank you.
Yeah, I think that's a great point, Regina. And I was kind of thinking, I wonder if Julie or Dwayne could comment about that, because some other people in the chat have also said, well, how long is telehealth really going to be approved by insurance, which may be also a huge component of how long people continue. Is there any way, I mean, someone can comment on Regina's comment, but maybe Dwayne, you could also weigh in on projection of that as well.
NASW, I'm sorry, Dwayne, but NASW has just is supporting the national office and asking for an indefinite extension of virtual work. So that's the push.
With all insurance payers though?
Well, we're asking for a legislative ruling right now. Dwayne, do you want to add to that?
Yeah, I mean, I think the private insurances right now, most of them are till the end of June, or at least it was till the executive order, which continually got extended. But we've been pushing for an indefinite extension of all of these. It's really hard to say at this point how that's going to work. I think as we move forward, we may need you all to take some advocacy and to share your stories, especially those of you who are seeing that your clients really prefer this method, because I think that is the case for a lot of folks. And I think the insurances maybe didn't actually think that was going to be the case. And I'm not sure that we can go back from now. And I don't think we want to go back, right? And so I think that we are internally pushing as much as we can as an organization, both statewide and nationally. And if there comes a time soon that we need your all advocacy as well, we'll let you know as soon as that happens.
And I can just add, as Dwayne said, it depends on what the executive order. What I heard in regards to the telehealth is that as long as we're under the executive order, then telehealth is something that is available. Those rules have been expanded specifically for Medicare, Medicaid. I can answer to those. Something that I saw in the group chat and then that was mentioned is this idea of, do you have to be in your office in order to provide services? So keep in mind that your office is as you've identified it. So if you have a physical office, you have registered that somewhere, business license, with your county, your city, with the insurance companies that you're a provider for. If you are going to start seeing people somewhere else, like your home or you temporarily at a different off-site, all you have to do is change or add that new address as your office. Once it becomes your office, you can see people there. So if your gazebo or you're walking around your home because you live kind of like where I do, where there's nobody, in sight, and you're walking around your property, you're at your office. If you are in a community and you walk down the street and you go off of your property, you're no longer in your office. I did see someone wondered about walking counseling. Not to mention there gets a lot of HIPAA concerns, confidentiality, if you're walking around a community. But regardless, just for the rule as your office, it's as you've identified it. So business-wise, or through the insurance companies, like CAQH, if you got it listed there, you can have as many offices as you want. So you can have your home as one as well. So I hope that helps.
Does that mean, Julie, that if you listed both your home and a physical office, if you did telehealth from your actual office, it would be a different place of service code?
No, what you would do, because, well, remember that the guidelines that we're using under the executive order for telehealth says that you're going to use the place of service that you normally would see the person. So if you normally saw them at the office, you're going to put your code in for the office. If you normally saw them out of your home, you're going to continue to use it in your home. That's for this executive order. Outside of COVID, let's just talk real briefly. If you have multiple offices, what you have to do is when you are doing your records, you just have to indicate which office you're in. Are you at the Kalamazoo office? Are you in the Denver office? Are you in the Gaylord office? Whatever that is, you just have to mark it, because that's one of the things that insurances and Medicare, Medicaid require, is that they know where the service took place.
I guess that would be part of my confusion, because what I'm hearing from insurance companies is that we're still required to use the place of service code 02 and not the 11 for the actual office. So it still seems like there's even inconsistencies for telehealth billing.
And that would be, and again, for Medicare, Medicaid, they're saying you're using code 95 for Medicare. And then your place of service is what you had normally seen the person prior to COVID kicking in. I can't speak to the individual insurances like Blue Cross or Cigna or Beacon. Those you'd have to check on individually, because like you said, Ashley, individual insurances can make up their own policies. So you're just going to need to check on those. But yeah, they definitely want to know where your place of service for Medicare, Medicaid is where it was.
You also want to double check too about the insurance requirements, because not all insurances nor EAPs, employee assistance programs, will allow a home office. So you really need to find that out, because it has to be ADA compliant, a separate entrance, all of those things. I have talked to United Healthcare, Cigna, and Blue Cross, and they all have authorized telehealth outside of COVID. They've always offered it. CompPsych also is another one. If you are a CompPsych, EAP, or managed care provider, they've always offered telehealth. So do your homework, contact these people, and find out as you're talking with them about the extension. And remember, the extensions, like I think someone alluded to, they're different in different parts of the country. San Francisco may be able to go swimming, and we may be at a stay-at-home order in Maine. So I think that, you know, it's going to be really difficult for them to do a blanket. But you need to talk to people individually, and you need to document about what you're doing. I'm going to sign off, but I wish everybody be safe and healthy.
Thanks, Nancy.
Same to you.
It seems like, Regina, the consensus is that doing telehealth with self-pay wouldn't be an issue. Really seems like insurance is kind of the challenge, which I know for a lot of people, keeping up on even just the telehealth regulations and guidelines. I feel like I get an email every other day from Priority Health or Blue Cross Blue Shield or whatever, you know, changing how we're asked to do it.
I just had a clarifying question. This is Raylan. For some reason, I was under the assumption that the place of service was where the client was at, and maybe less so about where the practitioner was at, that we had to confirm if the client was at home and making sure they were actually in the state of Michigan, so we're not practicing out of state lines. Do you know if that, I'm exposing my ignorance probably here, but what do other people?
So the place of service is the location where the practitioner is, because that's your office. If you, like myself, see people in the home, then place of service, there's a code for, the client's home. That one gets tricky. Medicare, Medicaid approve it. Some of the insurance companies do, but many of them do not. So home visits for some insurance companies are not available. But it is where the clinician is, not the client. As I think maybe, Raylene, some of the confusion came in when we were talking about, or when we were first moving to telehealth. There were many experienced telehealth clinicians who focused and made sure that we understood what we needed to do is report where the client was. So that was more like in our notes. And that was a safety, my understanding, it was a safety issue, that if you had a client who went into crisis, how would you be able to get them the help that needed? So if you needed to call 911 and you didn't know if your client was in their home or in their car or at some friend's house, how could you get help to them? And so that was my understanding of that element. But place of service is where the clinician is providing the service, the office.
Thank you so much. That's helpful. So it sounds like because I work within a group practice, that the takeaway would be we would have to have our biller add a practice location for all of our practitioners doing telehealth from home, to include a home office.
Well, keep in mind, and this is for Medicare, Medicaid, the direction is report place of service under COVID, report place of service as you normally did. So if you normally saw them in the office, it's still an office code. That's for COVID.
Okay. Glad.
But that, I think though, that's under the CMS stuff. But my understanding from some of the other insurances is we're still, if it's telehealth, we're still supposed to use the 02 instead of the 11 code. And, and then some of them, like somebody was saying, all of a sudden we get something saying something different. Oh, well, now do it the way you would ordinarily do it. So it gets very confusing. But some of them, I think, still want the 02 if it's telehealth, regardless of whether we're in our office or at home doing it.
Yeah, you definitely have to check those individual insurance companies. My answer was specific to Medicare and Medicaid. And then just to, somebody in the group chat commented on, this was connected to the other conversation. Our clients do have to be in the state of Michigan. We have to be in the state of Michigan. That's our licensure, unless we have, you've contacted that other state. But under the state of Michigan license, you have to practice, and your clients have to be in the state of Michigan at time of service.
Yeah, and if you were also licensed in New York and somebody was in New York, you could still see them telehealth, or as at least one of the ones that I caught on the text was Puerto Rico. So you'd have to be licensed in Puerto Rico unless the state is allowing, the other state is allowing something else. But if they're out of Michigan and we're only licensed in Michigan, then we and the client are kind of SOL.
So the ASW-B website has a, under their COVID-19 resources, if you click on for social workers, they are awesome, and they have created a drop-down list by state of what every state has decided to do about licensing. For example, I have a client that will probably be moving back to Ohio. And so when I read on the ASW-B website what Ohio is doing in the context of teletherapy and across state lines, they're saying, yes, you can still see your client that's already an established client, can't be a new person, and it only is until the executive order is lifted. But the thing on the ASW website, I can't find Puerto Rico on the drop-down list or any other of U.S. territories.
Yeah, Liz, I just saw that as well. I did put in the chat box the contact information for the NASW Puerto Rico chapter. They have not put anything on their website, so my guess is they probably have not made any changes. I mean, there's such a tiny group of social workers that are there, but for that specific client, I would recommend reaching out to that email, and it's just naswpuertorico@gmail.com.
Thank you.
I just want to say something a little tangential to this, which is I think we really need to talk a bit about the racial injustice, the impact on our clients and the impact on us before this call ends. I think it's a real critical issue, and as private practitioners and clinicians, I just think that this meeting really needs to spend some time acknowledging that the events have occurred and that they have significant impact on our diverse and disenfranchised clients. So that's my interruption.
It's a good point, Max, and I agree with you. I think if we stayed online together for 6 hours, we would still have points to make and questions that are brought up, not just on the topic of reopening, but on social justice and everything else that falls under social work. But you're right, it's a very timely topic, and this is something that we can touch on. So what I'm going to suggest, we have about half an hour left in the meeting. Let's kind of, Ashley, if you want to kind of guide us a little bit more and maybe see what else we have to talk about in regards to reopening or issues related to private practice. And then maybe we can kind of segue in, Max, to talking about that very critical topic.
Thank you.
Sure, yeah. I don't want to miss some of the comments that have been going on in the chat box. So Linda Morton, she talks about, she got a recent email from Assurance, liability insurance, and is concerned they're recommending telehealth. And if you want to see someone in person, they state they would need documentation why you would need to see them face-to-face versus telehealth. Does that mean that would maybe violate the coverage for liability insurance? And then Connie also, this may go back to what Regina said something about, I don't believe you can call sliding fees therapy if the charge is less than Medicare reimbursement. You can do skills or coaching fees, otherwise it's insurance fraud. I mean, I think part of the question for some people is, are liability companies going to encourage us to do in-person or telehealth? I'd be curious to see, you know, if Linda wants to expand on that, if she's still here, or if anyone else has any other thoughts about that component.
I don't hear Linda talking, but that is a concerning development, and I'm not sure that I know anything about it, but that is something I'm going to make a note of, and that maybe we can pursue or follow up on. It does concern me to hear a liability insurance company, especially one that is social work, trying to limit or change the way that we see our clients. So I will make a note of that.
I called NASW for something different, or the RRG, NASW, the insurance company, pay for something else, and they have a recording, like right at the beginning, that says, if you're calling about telehealth coverage, blah, 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 you know, basically like it's the same as your regular, but check with your state boards to find out anything to do with them. So that's not exactly the answer to this question, but it was something as far as telehealth. If you're looking for coverage, it's the same as in office was the gist of it. But anybody who wants to know who has that insurance, you can just call and listen to their recording as far as that part of it.
How are you all feeling about returning to in-person as a liability? Especially for those of you who own your own practices.
Well, I think that the fact that they're saying we should have everybody sign off waivers and things like that suggests that at least some people would try to make it a liability issue if, I suppose, they could prove that they acquired COVID in one's office. I'm not sure how somebody could prove that unless that was the only place they ever went. But, you know, that suggests it. I have clients when I've said, you know, when they've asked about things, you know, and I've brought up the fact that we may have to do something with you know, a sign off, you know, and they just roll their eyes as if it's just complicating things further. And I certainly see that as well, but I still want to cover myself. So I don't know how somebody would prove exactly where they got it.
That's an interesting perspective, because I think the other thing to consider is also landlord requirements. So for instance, in the office that I rent, the landlord is requiring things that I personally would not require. But because I am in that space, I have to also require that as well. And they've talked about how they know several people who are in the process of getting sued, or they have concerns about someone proving that they did contract COVID from that office, which I know, I agree with you. How would you really be able to prove that? But my landlord has had some personal experience with that happening, which makes me pretty leery and concerned about that.
I think maybe,
You know, I think what it comes down to at the end of the day is something that I think most social workers are really skilled at, and that's our documentation. You know, what steps have we taken? Do you have a log? Do you have it organized? But what are you doing? Are you taking your temperature every day? Are you recording that you're symptom free? Are you doing the temperature checks on your clients? Are you disinfecting in between each? Do you have a policy that states that you're doing these things? And then do you record it? So there's a place in my EMR on my notes that on the mental status that has an other, and I'm putting each client's temperature down in that other space, so that, you know, that's my way of demonstrating that, yep, I'm following the procedure that was created, which is to take the temperature when I first come in. And then again, the policy states I'm going to have a mask or now a face shield. You know, I'm going to use disinfectant. It just all gets written down, and then we document it and we send a letter out, or we give notice to our clients. These are the standards that we now have to follow because of COVID. And we're going to get pushback. There's going to be some people who roll their eyes, as was said, or there's going to be people who are going to say, well, I'm not going to do it. This is part of our ethical responsibility. Going back to Ashley's earlier comment about ethics, ethically, if we don't hold up to the standards that are set in place by the CDC, the federal government, saying for safety reasons, this is what we need to do, then we are in breach, I believe, of our code of ethics for protecting our clients, because we're not protecting ourselves, we're not protecting that individual client, and we're not protecting the clients that come after them. So if a client chooses not to follow, the policies that you establish in your practice, it is up to them, their choice, they can walk away. You do not have to see them if they're not going to adhere to your policies.
I second what Julie says. So I know I'm in a different setting than everybody else. Being in a hospital, we have separate requirements that are across the medical center, but I think some of the things that we are doing can be applied to private practice, where with every encounter that I have with a client, even if it's over the phone, I am doing symptom screenings for COVID at every single encounter. And that is documented, within every note in our EMR system. If there are times, since we're a hospital, we still have people coming in. We try to limit our face-to-face contact, but if I do meet with somebody in person, it is very clear where we met, that we maintained social distancing. We took proper, COVID precautions. Both myself and the client were wearing masks, and that is very clearly stated. And I'll even say, it was a brief encounter. We did what we'll address everything else over the phone, whatever that may be. But I agree with Julie that the very detailed documentation is important, and whether it be the temperature checks or even the COVID symptom screenings to put at the end of each of your notes, I think it would be valuable to add.
Great point about documentation. And I don't know if this helps. I also want to leave some time to talk about the racial justice piece too. And I'm happy to share, I actually publicly, per the executive order, posted my COVID-19 response plan on my website. So I'm happy to share that link if someone frankly just wants to copy it. I think we're all in this together. So if you want to save yourself the work. At the end of the day, again, I don't know if this helps. This is totally just me. I decided I'm not really going to go back to in-person unless I absolutely have to. Is that there's just so much in flux, especially if there's potentially a second wave, that, there's just so much to consider. And until we know a little bit more about it, I'm just wanting more information until I make a decision. Not everyone's in that situation, but I don't know if that's helpful to hear from someone else.
This is Patrice up in the UP again, and that is helpful. Can you hear me okay?
Yes.
Yeah.
Okay. That is helpful for me to hear. I put something in the chat box, but I've been doing private practice on my own. I have an office the past 10 years in Munising, and my husband has a compromised system, and he's hoping that I don't go back, and I need to honor that. We are one of the only, one of 3 counties that doesn't have it diagnosed yet, but we will. And knowing, I know, you should all come here. Knowing that it's going to be worse, it doesn't make sense for me that I haven't been to the office and, I'm going to. So I feel very sad about thinking I'm not going to be going back to the office. I have clients that are asking about it. Most of my clients are fine with telehealth, but some are waiting till I go back. So my question was, we live in the middle of the Hiawatha National Forest, so it's very private. I purchased this huge screen tent. So that was one thing that I wondered too, is if I could meet with people on my property here. So, and some people have kind of talked about that. If you have a second office, check with insurances, but that's temporary, while the season kind of permits. So, but otherwise I'm hoping I can continue with telehealth as well. Thank you.
Yeah, thank you for sharing. One of the things that I think is really helpful about the NASW practice guidelines that they put about reopening is that they do highlight things like that, Patrice. You also, at the end of the day, we can talk about this all day long, right? But you have to do what's best for you. If you have compromised immune system, if you're frankly just scared and you don't want to, I think it's part of collaborating with what are our ethical responsibilities and what are other people doing and sharing information and resources. But you have just as much of a right to protect yourself, even if it's just your mental health, as a business owner, as a clinician, than you do to clients. If you're not well, your clients can't be well either.
I agree. Thank you. Thank you so much. the other thing that I've wondered about, if I do see some of the clients here on our property in the big screen room, and if I list another office there, does it have to be, I'm just wondering, do I have to have my private address on there, or is there any other way to have a location of an office without
Nope.
private office being listed out there?
No, that's one of the challenges. If you are using your home address, then it's going to be posted.
Okay.
Yeah.
Okay.
Yeah.
Thank you.
So this is a great conversation. Ashley, thank you so much for kind of guiding us through this. I really appreciate it. I do want to, we're at 11:13. So I have a feeling this will be something we continue to talk about in the various formats. So just keep an eye on the emails. And as always, if you have a specific question, you know, you can send it into Dwayne or you can send it to myself specifically. Either way will work. And usually Dwayne just forwards it on to me if he doesn't know the answer anyways, so that's okay. But because we're talking about taking care of ourselves as we wrap up the discussion about reopening, let's talk about, you know, let's talk about what's going on nationwide. Let's talk about social injustice. Let's talk about how it's affecting our clients and ourselves, as Max suggested. I definitely know, again, so many people are left at home, or they're staying at home more, and so they're getting that television screen a little bit more maybe than they're used to. Perhaps we are too, and we're getting images and we're hearing these horrible stories and we're seeing these tragedies across our nation. How are people doing?
It definitely is something that you need to monitor and not let it be on all the time, because some of it is so disturbing to watch that I know I'm on my husband all the time. Turn that TV off. Do not have those channels on. That's 24/7 of that. It's not healthy. I mean, so I know for me, I really do have to set limits on. I can't be hearing or watching it endlessly. It really does take some boundaries for me because it is so disturbing.
Okay.
Go ahead. Okay, I was going to say, I see a number of people clients who are disenfranchised, either because they're poor or because they're transitioning or because they're Black. And I really have to be present for them, and really, you know, look at my own triggers and what's going on for me around this, so that I can be really available to my clients. This affects, you know, probably all of the clients that I see in one way or another. I just see it as a critical time for us to be introspective and to identify our own sort of issue and find ways to be present with our clients, which is difficult. This is awful. You know, we go from a pandemic to police brutality, to targeting disenfranchised groups. It's a tough time to be a social worker who advocates for social justice and a therapist who needs to be present as people do their grieving and work through their own issues. So that's been my experience.
I think, Max, you touched on something significant, and that's the rolling effect. So I know I spent a lot of time with my clients trying to reassure them about their own health and safety and what COVID will do to them. And now these images and these actions that are taking place. And I live in Berrien, I live in a rural area in Michigan, so we see most of the violence on the television, but it's the idea that it's happening and the fear that it brings. So I've reflected, again, most of my clients are older, and so I've reflected, I've said, well, what was it like in 1968? What was it like, when did you feel this way before? And we kind of reflect back. And I usually try to kind of bring it around as, how did we get out of it? What did we do? What could we do differently? What can you do? I encourage a lot of my clients to be politically active in the way of, because of the feelings of helplessness and powerlessness that so many of them, because they're homebound, feel. And I said, you can contact your congressperson, you can contact your representative and voice to them how you feel about something. And so if they're voting on something, or if you see something in the media and you agree with it or you disagree with it, let your representative know, because that's your way of adding your voice and maybe helping to influence your representative or your congressperson to vote in a way that you feel powerful about or you feel strongly about. And so it's, just trying to take away that feeling of helplessness. And for the most part, I don't think most of them do it, but I think it's the idea that they could, that kind of relieves some of that feeling of, I can't do anything. All I can do is sit in my home. Our other
had
people,
3 clients tell me that they've been out protesting, and so of course I'm concerned about their exposure too. And so on TV they've been reminding protesters to get tested, and so I'm going to be reminding my clients about that too.
And I have people who have been feeling guilty that they haven't participated in the protests because they maybe are at high risk for COVID and don't dare go out in a group. And it's a matter of reassuring them that we all have to look at our own circumstances and limitations as to what we're able to do, and find ways of being involved. But that it's okay not to go to the protests for their own particular reasons.
I like that. I like giving permission to not do something. I think that's powerful. Nice.
I think one of the things that, go ahead.
Go ahead.
That I recommended, I don't know if any of you know Jane Elliott, but like going to her, like you can see them on YouTube. She started out, I guess, back in the 60s, teaching elementary school kids, taking one of those exercises that probably all of us as social workers have done, but like, okay, all you blue-eyed people are in that group and you green-eyed people, and kind of setting people up as, now you're the group that has no power or whatever. But I've even told people like, this would be a great, all you people who are teaching at home, like this might be a really good activity to do, because some of the Black leaders are saying, at the very least, educate yourself. And she's a good, even though she's white, she's a good person because she will teach you. And when she started doing this, was her and her whole family were ostracized and labeled and whatever. But the Black leaders are saying, if nothing else, and I found that that's really been a good thing for me to say to people, is we'll just learn more about it. Like, go and watch some of these things so you have a better understanding of, what and why, these things are happening. And you know, I went and I looked and I watched some of her stuff and it was like, this is really good. I mean, and it is, even if that's all we can do, I happen to feel very guilty that I'm not out protesting. I am one of those people because we all want to be part of, listen to our voices. But sometimes just coming up with something where it's like, even if you just educate yourself a little bit, or I think those are also can be helpful for other people to look at. Just learn more.
I did something called Erase training at Kalamazoo College this January, and it's a really awesome thing that's available in Michigan. It's like a 2.5-day training, including everyone, but really there's steps you take to really understand the racial disparity, the institutional racism and how it impacts people. And I think for me, the most stunning thing, because I considered myself fairly open and understanding, but when we made a timeline of events, I was so stunned at how deep racism goes and how we shift who's right and who's wrong depending on the color of the skin. And that's so clear just even in these atrocious murders, watching the footage of a young man running and being hunted. Those guys who killed him sure knew that they were likely to get away with it. They didn't even try to do it under the cover of night. They did it in the day. And that the narrative for, say, the ambulance driver who was in her own home in bed, the castle laws don't seem to apply to her household, but if it was a white person in their household, they sure would apply. So I hope that if you ever have a chance to do the Erase training, you do it. Be nice maybe to figure out if there's a way that people could get some CEUs and do it. But it's really one of the most enlightening things I've ever participated in.
Who sponsors it? Who puts it on?
I will have to get that information and get it to you.
I'd appreciate it. Thank you.
Okay.
You know, I sometimes think about myself being Jewish and a lesbian, and you know, the targets that I have, but the bottom line is that I can always assimilate. And it's that issue of assimilation that I think sort of removes me a little bit from really understanding the impact, which is why Algeria's article, if you get a chance to read it, if you already, is powerful. And with my clients, they're so afraid, especially my trans clients who are Latino or African American, are so afraid of being harmed physically or killed that it just complicates and adds to the depression that already exists and the challenges of transitioning.
So, you know, basically what I'm hearing some really good comments and interventions that people are using with their clients. I appreciate that, and resources. And there was several that are in the chat, which is wonderful. I'm wondering how we're taking care of ourselves. So Maureen, you shared you're stepping away from the TV, which I think that's a great way of doing that. Dwayne talked in the beginning of the meeting about, you know, the self-care actions that NASW-Michigan is putting out so that we have resources to go to. But what are we doing to take care of ourselves right now while we're taking care of our clients, while we're staying up to date on the news, but not too much, while we're still taking care of our families, perhaps, our businesses, and trying to get through COVID, and now this. How are we taking care of ourselves? And I'm hoping that some people can share some things that you're doing.
I do work out frequently, which helps, but I gotta say, when I see so much where people still don't believe and still blame the victims and stuff, that, I mean, even talking about it, I'm like tearing up, because it's like, that's so hard, you know, in terms of, you know, I feel like my soul, that becomes very overwhelming a lot of the times when I see or hear things where there's just so much. And it's like, you can watch it on TV now, like there are videos of what's happening, and still having to deal with that, though, the systemic racism where people just won't even believe it. So I find that is maybe my biggest challenge, is listening to people. And I think when clients are talking about things that are very, it's like drawing that line between, like, I'm here for therapy for them. It's not my role, and I have to be careful not to say, like, what are you talking about? That makes it very difficult. It just doesn't matter how much self-care, it's still really heartbreaking.
Anybody else? So I think it's good to recognize that, you know, we're hurt by this, and maybe we're angry by this, and frustrated, and everything else that goes in when we see social injustice. I was born in the city of Detroit in 1968, and my parents would tell the story about standing outside the house and looking down our block and watching the tanks roll in. Both my parents were social workers. So social justice and in situations like this, I feel like have always been a part of my life, and they have for everybody, not just people, you know, born in 1968, of course. I get tired of it. I get tired of having to have the same conversations. I get tired of having to try to figure out new ways of having the conversations to try to help people who maybe through ignorance or fear or bias or hatred don't see things in the way that I do and that I believe most social workers do. That's the time where I look towards my supports and the people who I love and who love me back and who are good for me, people who I can vent with and I can get a hug with, which you can't do as much, but those are still people, you know, I have a house full of people. And then remember that the next day, there's going to be something good. Somebody's going to stand up. Somebody's going to say something meaningful. Somebody is going to say, I saw things the wrong way and now I'm beginning to understand. Somebody is going to make a new policy or new law. We're going to look at our elected officials and say, can we do better? We're going to look at business people and we're going to see things that they put in their business that says, I reject and renounce racism and bias and hatred. So each new day we wake up, there's good things going on. The sun is out, the birds are chirping. Find the good thing. That's what I'm looking through. Every day I'm trying to find the new good thing to get me through till tomorrow, and then tomorrow, and tomorrow. So I appreciate everybody's comments. This has been a fantastic discussion. Ashley, again, thank you to you for picking up the pieces of this, you know, restarting and helping me out in that regards. And to everybody who is on this call or is already off, thank you for your comments and for your presence. Even if you didn't comment directly, I appreciate you being present. It is 11:32, so I do want to be respectful of people's times. Does anybody have anything else that they would like to say or share?
Yes. Of course. Just remember that we meet again in 2 weeks. And that meeting is a little bit more directed at being a support group for those of us who are clinicians, actually for anyone. And it's open to members and non-members as a time for open sharing and support and anything else that people want to use it for. So that's in 2 weeks. We're meeting the first and third Fridays of every month, and the time is the same.
Wonderful. Ashley, did you have anything that you wanted to add?
No, I don't think so. I appreciate you letting me be involved. I guess I just wanted to confirm, when's our next private practice group meeting? Is that in July? I thought we took a break.
Usually we do, and I realized that this morning, Ashley, so thanks for bringing that up. Usually the private practice group does take July off. We're in this weird COVID time, so maybe, Dwayne, we need to consider, do we keep it, or do we keep July, or do we skip July for the private practice group? That's the only one we're talking about here, the private practice group.
If it helps, the first Friday of July is the 3rd, so right before the 4th of July. I'd be happy to meet, but that may be a challenge.
I think that's why we generally don't meet. Dwayne, what do you think?
Yeah, that was going to be my suggestion, is just to point out that it was the 3rd, so I think that's probably going to be bad for most folks. And now that we have other meetings on the 2nd and 4th Friday, moving it back a week wouldn't work either, because that time slot's already taken by another Zoom call for us. However, we could just do a regular phone meeting if folks wanted to push it back a week, but it wouldn't be Zoom.
Okay. All right. Well, I'll tell you what, if people, if you're feeling strongly that a July 3rd meeting would be good and that you can commit to that, could you let us know? And if we have enough interest, we'll go ahead and do it. If not, we'll just assume that it's July 3rd and we'll see everybody in August. Again, for the private practice meeting, not for the other meetings.
Yeah, the support group will still meet the 3rd Friday.
Yeah. Okay.
Thank you all.
If no one has anything else, enjoy your day. I hope you get some sunshine.
Thank you.
Thank you.
Thank you. Thanks. Bye-bye.
Thanks,
Bye.
everyone.